Happy evening to you all. This is regarding hypertension. Hypertension is known as a silent killer because in most cases of even very high blood pressure levels, the patient might be symptomless or might have slight headache, dizziness, tiredness, etc. That is why we advocate every time a person goes to a doctor. It is ideal that they have their pressure checked up, especially after the age of 40. This is very important because I'll just highlight on the three major complications of hypertension. One is what we call tube bursts, second is pump fails, and third is filter leaks. So the tube bursts is suddenly the reason the blood pressure can cause bleeding of the cerebral vessels. Whereas in diabetes, slow progression occlusion causes clot and those things stroke. Hypertension, sudden surge, rupture of the blood vessels, tube burst can cause intracerebral hemorrhage, which is life threatening. Very few patients survive this. Second is the pump fails. Pump is what? The heart. So you develop continuously pumping against a high pressure. The heart becomes hypertrophied. It is like exercising and then developing the muscles. So what we call hypertrophy of the heart. So once the heart is thickened, the blood flow to the heart is diminished, and if there are associated problems like diabetes and high cholesterol levels, already narrowed vessels, flow, which is higher flow is required, is not provided, you can develop a heart attack, following which you can develop heart failure. So that is what's called pump fails. It's very difficult after that, living with oxygen and all that. And the third those thing is eventually one of the major complications of prolonged high blood pressure is the filter leaks. Filter is what? The kidney. So you have you develop kidney failure gradually over this thing to end stage renal failure unless this is corrected. That is why we call hypertension as a silent killer and diabetes as a sweet killer. So regarding any other this thing of hypertension, this is not to frighten you, this is an awareness so that you understand you should not skip even a single day's tablet if you have got high blood pressure. So the rest you please discuss with your family physician. Thank you. Wish you all a wonderful evening.